All right, what's up, guys? It's Dr. Dan over here. We got Jay in the house. We're going to go through a chiro appointment. Jay is a CrossFitter, marathon runner. Why don't you tell him a little bit about yourself?
Avid golfer in the summertime. Have lots of issues with the knee pain from an existing injury, and lower tight backness tends to hit me quite a bit with the certain CrossFit moves that we tend to do often.
So Jay's been a patient here for a while. We're going to go through a full treatment with him, work on his neck, his mid-back, his low back. Probably do a little knee work. We'll do some stretching. You guys will see how we'll do it, and then we'll finish up with the adjustment. All right, let's spin around this way for me. And then for today's video, guys, we're going to be using the Ached Away personal massage gun, right? So this is just like a Hypervolt. It's a little bit cheaper of a version. It's got 5 different speeds. I like speed 3, which most people can tolerate. If we need to cut it down to like speed 1 or 2, sometimes for elderly population or people that are really tight, we'll cut it back down to the lower speeds. But we're going to use this up on his neck, his shoulder muscles, and then down into his hips. And you see how we do some of the myofascial release as well into the different areas. And what we start off with, a little scan of the neck, of the shoulders. You guys have seen how we check out a lot of our other patients in videos. Jay's got some gunk up here around the right, levator scap, the upper border of the scapula experiences a lot of just tension in people. So we're definitely going to work on his right side here. And we're doing our little shoulder check, and we can feel his left glenohumeral joint moves pretty nicely. And his right side does as well. But let's just roll these guys down a little bit like that. So in all of our videos, you'll see how much we talk about back chain dominance. And we want back chain strength to originate down in the lats and the triceps to offset a lot of the neck tension that we develop throughout our day, whether it's sitting at the computer all day. Nowadays, we're all quarantined at home, so maybe a little too much Netflix or TV time. Super important to develop your back chain and release tension in the spots that it doesn't belong. So definitely up around the neck, the shoulder. And Jay is used to, he's used to the Hypervolt. So this is a new massage, Ached Away massage gun. You can feel it's a little less powerful than the Hypervolt. That's what I've noticed.
Mm-hmm.
Crank it up speed 4 on him. And then, like he said, avid golfer, likes to work out. You've done half marathon or a couple full marathons?
Fulls, halves. Yeah, I've done them all.
So he runs, swings the golf clubs, likes to lift heavy weights. You might see him in some of our gym videos because we just got him over in the gym working out, so he's going to become a little more functional with his rotational patterns. And what I'm going to say, you're going to hit it hard the next 4 or 5 months. Golf season will be totally different for you, man.
Good.
As you learn to rotate a little better. Knee pain's going to go away, and we'll probably do a little knee treatment today. What is it, your right knee?
Yeah. Old soccer injury.
You played soccer for how long?
18 years.
And now you coach, right?
Yeah, I'm used to. My kids are old enough now, they're moved on, but I coached for 7 years.
Nice, man. So played, coached, athlete all around. Look down straight for me. And then primarily with the handheld gun, doesn't matter what brand it is, whether it's a Hypervolt, Ached Away, there are so many of them out now. I think a lot of them are the same models, just different companies have renamed them and charged different prices for them. But best treatment in the upper body is to just work right around the top of the scapula and then down the inside border, right along the spine. Look straight down for me, dude. Lots of work up in the upper trap muscles. And we're going to just tell him to just let this sink down a little lower in the scapula. Good. Pull your head over to the right for me. And let's come over to this side. And so for our chiropractic treatments here at the office, we always start with a little bit of vibration therapy up into the upper body to help loosen up the neck muscles. Step 2 for us, for our chiropractors here, is myofascial release up into the suboccipitals and up in the neck and the shoulder muscles, just to help decompress everything that builds up stress-wise up here. So let's just hold right there for me. Lotion we like to use is called Sombra, and it's got a couple different forms. There's like a heating effect, and then they have another brand that's a cooling, kind of a cooling effect. Look down for me. And I really started to get into soft tissue work probably like a year, 2 years into practice. Instead of just getting in and adjusting the skeleton, adjusting the spine, soft tissue work really helps us to kind of scan the different vertebrae throughout the neck, the mid-back, the low back. And it helps us to generally get a little bit of an easier adjustment as we loosen up some of the tight muscles and some of the tight stress points. Lots of people up in the upper cervical spine, the suboccipitals. He's got a little guy right here that he feels. Look up. And people always ask, what is that? What is that up there? Why is it so sore? And the longer I do this, the more I just say, it's just junk. It's tension. It's stress. It's just muscle junk that builds up. It's like congestion. If you ever get congested up in your nose or your sinus cavities, you know how it's like difficult to breathe. And our body undergoes all kinds of different stressors, like physical stressors from not stretching enough, not exercising enough, or even just sitting too much. We undergo chemical stressors, so when we eat bad foods that inflame our body, we can end up with tight, painful muscles. And the third one is definitely the emotional stress. Emotional stress, throughout our work day, our life, our home, wherever we have that emotional stress at, it can build up, it can manifest in the body and create a lot of stress points. Straight down, straight up. All right, so right now we're working on Jay's upper trap, levator scap, a little bit of the supraspinatus as we get over on the scapula here. Look up, look straight down for me, bro. And what I'm doing, we're really driving our thumb, look straight up, straight down, straight up, straight down, straight up, straight down, straight up, straight down. Straight up, straight down, straight up, straight down, straight up, and down. And again, you've heard me say it before, not just him. So many people get just this tension up here. Lots of knotted up fibrous material tension in the muscles and the tendons. Whoops. The rhomboid muscles, the levator scap. This stuff just gets so tight in people. A lot of times if you roll your shoulder around, you might hear like a big click or a big pop. And a lot of times, it can be the rotator cuff tendons, but a lot of times also it's the knotted up just fibrous tissue that locks down the scapula. Look up, look down, look up, look down, look up, look down, look up, and now shoulder down. So, push, and stop. Other area that we like to work in the upper body is getting that hand into a safe overhead position. Left arm up, and then left shoulder down. And we really work on packing the shoulder. And packing the shoulder means depressing it down into the joint so that we can loosen up the upper neck muscles, the upper tract. Push forward to your elbow, and then just stop, and now shoulder down. Push, and stop. And Jason is actively pulling his left shoulder down into the joint. Push, and stop. And doing something that we call packing the shoulder. So he's really kind of depressing or pulling using his lats, his serratus anterior muscle, some of these lower shoulder muscles, with a little help, a little guidance from me to just like lower, soften that neck up, like that. Boom. And now right arm up. And this is just a nice little easy move. Now shoulder down, correct. And you saw how you just made that little pull down. Do it again, a little shoulder pull down again. Beautiful. Now push forward and stop. Push forward and stop. Now shoulder down. Good. Beautiful. Relax. Straight up, head straight down, chin to chest. Head straight up, head straight down, head straight up, head straight down, head straight up, down, up, down, up, down, up, down, up, down. Hold it, shoulders down for me. There you go. All right, so before we even get into treatment, I'm going to give Jay one exercise to work on to help establish better back chain strength. We're going to tell him as he's watching football today and tomorrow, throughout the playoffs, sit at the edge of the couch a little closer. Open your hands up back here with me and put your palms down. So we're going to tell Jay to sit at the edge of his couch. He's going to lean back into his hands to weight his hands a little bit. We're going to help him to identify if his neck muscles are a little tight. Let's drive down through your palms a little more. Perfect. And then just think chest up a little bit. So as Jay's watching football today, we want him to take a break every 20 minutes for maybe 2, 3, 4, 5 minutes. Get his hands back at the back or the base of the couch. He's going to work on a little shift over to the left side. Roll the left shoulder open. And then straighten that left elbow. We're going to really teach him how to load this tricep and this lat. And then over to the right side. Straighten the right elbow. Just roll this guy back a little bit. So maybe during a commercial break, over to the left side. He might spend the 2 or the 3 minutes during the commercial break establishing a better power center out of his tricep and his lat here. So he can like soften the neck up, back to center. Both elbows locked out. Head up nice and high. Lift this guy up. Relax your neck a little bit. Right there. There you go. You see how you're soft up here now? We want him to just work on his deep breathing. Deep breath in. Exhale out. Drive down through the palms. Straighten the elbows. Fire the lats, the mid-back. Create that better extension through the T-spine. So, muscle work to the neck. Rehab exercises. Let's get him adjusted now. Let's go face down. All right, guys. So in the lower body, we like to check his ankle, his leg, his knee flexibility. We know he has a pre-existing right knee injury from, you said soccer a long time ago?
Yep.
Exacerbated through weightlifting, crossfitting, running, something he's been dealing with for a while. We can see and he can feel how his left ankle kind of rotates outward nicely, but he's got a lot more tension in this right ankle. Left ankle bounces nicely, right ankle's a little stiffer. When we push down in the left heel, he's got a little bit of flexibility in his plantar flexion, but definitely his right foot. Do you feel that side's a little stiffer over here?
Yep.
Is there pain on the left side at all?
No.
Is there pain on the right side at all?
It's tight.
Just tight. So he definitely notices that the right ankle, the right heel, the right mortise joint is what we're checking. One of the ankle joints, it's a little stiffer over on this right leg. Visually, we can see that his left ankle rotates inward, or his heel rotates outward a little easier than this stiffer right leg. So he knows he's got some rehab at home we've talked about in previous appointments, which is going to be our rocker position. You guys will be able to see some videos of that on the YouTube channel. I'm gonna raise this up, okay? Just as we did in the upper body, we're gonna do some myofascial release, some deep muscle stripping up and down the spine. He said today, he said, man, my low back's pretty tight. And we can definitely feel kind of over on the right side, right along the spinous processes. He's got a little junk right here, right, man?
Mm-hmm.
So when patients come into the office and maybe they've never been to a chiropractor, you know, they always ask like, what's my issue? What's my issue? Do I have a disc issue? And we can't see the discs in the spine without an MRI, but we can feel the vertebrae in the spine, and we can feel where there's tenderness, like that guy right there. And we can make the assumption that when the muscles are real tight around the spinous processes, that you do have compression or tightness. Your vertebrae, they smash down here when you got chronic low back tension. And we have low back tension for a number of reasons. Maybe we don't stretch the legs and the spine enough. Maybe we don't diaphragmatically breathe in and out of the abdomen nice and strong. Maybe we sit on the couch or at work in a little bit of a crooked position and we develop muscle imbalance in the lower body or in the anywhere in the body, really. And when things get tight, they start to hurt. So we're going to work on a little myofascial release down into the low back, just to help loosen up some of the erector muscles, the quadratus lumborum, and a lot of these low back muscles that just get tight. Jason started to use the Hypervibe a little more. That's going to help him long term to loosen up muscles throughout his body, down in his feet, his legs, and the whole way up through the spine. Good. All right, back down. Now a little better, but still stiff in the right ankle. So we're going to hit that with a couple adjustments. But first, a little bit of treatment with the ache away gun down into the hip crest. So we got his sacrum right here. The sacrum is like the lowest, biggest bone in your spine. And then you got your two hip bones, your right hip, your right ilium, and your left ilium. The glute muscles, this kind of big glute muscle right here, it attaches up around the crest, down along the sacrum. Lots of people may end up with tendinitis of the glutes or even the IT bends, which are a little further out. So in conjunction with, you know, chiropractic care, muscle work like we're doing to his lower body, we're also going to get him doing some rehab exercises over in the gym to help him reestablish that back chain dominance, that back chain strength. And I think you said you have one of these at home, right?
Yep.
So he's got his own Hypervolt at home. Probably uses it a couple times a week. Couple times a day. So we do try to get all of our patients, our gym clients, to do as much at-home mobility and flexibility work as you can, right? So we talk about proper sitting positions, proper standing positions, but we do recommend different tools to use to help improve, you know, your health care at your house. You got to be proactive. And a personal vibration gun, spot vibration gun like this, either the Ached Away or the Hypervolt, is a great tool to just have in your living room. You know, if you're watching TV at the end of the day, you can use it on your arms, you can use it on your legs. We do teach patients how to use this on their own hips. I think we have some videos on the YouTube channel for that. And it's really good to focus like right around the sacrum. The base of the sacrum where the L5 vertebrae, which is like right here, kind of meets the sacrum. The SI joints get junked up. Tendinitis develops. Basically just muscle inflammation, tendon inflammation. If you've ever sprained your low back, you know, it's like, oh, I have so much pain down here. So vibration therapy is a great tool to use in the office and at home to create better circulation, a little bit of movement down into the different joints that we're working on. Bend this leg up. Push forward for me. Stop. Push. Stop. And it looks like Jay's been working pretty good. Push. Stop. There's a little adjustment right there. Push. Jay's been working pretty good on some of his quad flexibility. Push. And stop. Push. And stop. Push. And stop. Push. And stop. Beautiful. All right. We'll hit his toes in a face-up position as well. But we do like to get this mega plantar flexion, so I'm going to grip his toes. We're going to get him to really reform his plantar fascia strength and his arches down his foot. We crush a lot of the lateral leg tendinitis that develops as we run and as we move incorrectly. So the front chain stretch, one of mine and Dr. Emily's best stretches that we do is this big front chain stretch. We grab the toes, we get him to flex as long as he's comfortable. Probably has a little burning down the outside of the ankle. Go ahead, push for me. Push a little harder and stop. Push and stop. Push, stop. Push and stop. And push and stop. And then this left leg, let's check that right side one more time. Good, man. Push. So we're pretty good at getting heel back to butt. Push. So he's made some good progress with some of the rocker and the mobility work that we've recommended to him to do at home. Okay? All right, let's get a nice little easy adjustment into the mid-back. Deep inhale. Exhale out. Whole way down for me. Good. Deep breath in. Exhale out. Good. Deep breath in. Exhale out. Good. One more in and out. Good. All right. So a little bit of extension into the thoracic spine. Let's go ahead and face me over here. Left side up for me, bro. Here like this. We're going to get the hand right up on the side of the spinous processes. I'm going to rotate them gently. Good job. Other side for me. Hey, that was good. Good movement, man. Switch here. Straighten here. Drop this. Pull here. Deep inhale. Exhale out. Relax that upper. All right, flattening back for me, dude. So nice movement in the low back today. Jay knows how important foot flexibility is. So you guys will see in some other foot training videos how much plantar flexion we want to get down in the feet. And so many people get like these lateral leg. I think you battled shin splints big time, right?
Oh yeah.
Relax this foot. Good. And we're adjusting the cuboid bone, which is way out here. We're getting a little bit of toe flexion and big toe flexion. We love, 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 love when we get the ankles flexible. If you guys can see in the video, Jay's left ankle moves nicely down. His right ankle, he's got some stiffness, right? You can feel this flexibility here. A little more tension on this right leg, but he does have that old right knee injury. So before we go any further, let's just do a little release to lateral leg muscles. He's had this done before. I'm going to pull your sock down a little bit. And this is just another technique that we do. It's like muscle scraping. And it's called instrument-assisted soft tissue mobilization. And this just helps us to get over the retinaculum, which is like the wrapping of all the tendons right here in the ankle. And then kind of higher up in the lateral leg here, the peroneals and the tib anterior, some of the lateral leg muscles. They just get real tight out here. The muscles get sticky against the bone. He knows from some of the workouts he's been doing how much his ankles, you feel your ankles burn pretty good, right?
Yeah.
So lots of people get so much connective tissue tightness, like right through this lateral ankle. And what we're doing is just helping to promote a little circulation down into the lateral ankle. And then I'm going to finish that up just with just a little bit of myofascial release right up the lateral tibia here. Right in between the tibia and the femur. And sometimes this is a little painful. How's that feel right in there? Is that okay?
It feels wonderful.
Feels wonderful. So he's got a big, just an adhesion, just a tight area right there that we hone in on. Guys, keep in mind, throughout life, your body, it gets so tight, right? Your muscles, they develop these massive nodules, these fibrous adhesions. And the muscles, they grow, right? They grow, and they tighten up and they stiffen up around the bone. Lots of people end up with calcific tendons and arthritis. Arthritis is like bone spurring and joint inflammation. But basically, the muscles get so knotted up and so fibrous. And that's what causes your joints to move less, or the joints become restricted, like the knee joint, the ankle joint. Your feet get stiff. So from a chiropractic perspective, we try to loosen the bones up with adjustments, but we also have to treat the soft tissue structures to help those bones decompress and loosen up a little bit more. And then lastly, we've got to teach proper movement patterns while we run, walk, weight lift, even just stretching. You can stretch the right way or you can stretch the wrong way. Okay, let's relax this left ankle. That side's good. That side's good. All right, let's put this back on. A little foot adjustment. Good. And right side. Good. So Jay knows he's going to work on his plantar flexion at home. Squeeze your left toes. Squeeze your right toes. So at home, he's working on developing better back chain strength by really flexing the toes down, pointing the legs, getting his connective tissue in the front chain right here to stretch out nicely. Okay? Relax, bend this left knee up. And we're doing a little fibular head adjustment. And this is his tighter knee, so we're going to go a little easier. There goes a little bit. Good. And one more in this ankle. All right. Good stuff, man. All right. Easy up into the neck. I think last adjustment was like a month or two, 6 weeks ago or something? All right. Easy on the left shoulder. Relax that left neck. Beautiful. One more here. On that. Good. All right, man. Sit up tall. Spin that way. Then we're just going to finish up with a little A to P. That means anterior to posterior. All right. Easy shoulder adjustment. All right, finish up. Hands back on hips, on your butt right here. Always working to mobilize and stretch the front chain and develop better back chain strength. So we know we started with that rested position back into the spine. A little bit of an easier exercise. He's going to drive his hands right into his hips. He's going to gently roll his shoulders open. He's going to start to identify if he is tight up in his neck. We're going to lower the shoulder blades down. And he's going to go home today and he's going to relax and watch some TV. He's going to work on hand pressure, lat activation, softness up in the neck. So we can mega strengthen the lats, the mid-back, teach him how to take his tension out of his neck and direct it down here into that backside nice and strong. Maybe 20 seconds, 30 seconds, or even up to 2 or 3 minutes here as you watch your games. Okay?
Sounds good.
All right, man. Thanks for the adjustments, guys.
Thanks.
We'll see you guys on future videos, comments, questions, anything like that. We did ankle treatment, leg treatment, a little bit of myofascial release to his neck, his mid-back. He was a great patient today.
Thanks, Nick.